Yeah, Brahmin, that's for introduction. Me pesame da pasa sa cordione first Ghana sorry set. Mama me opportunity set. Member my name I can't cardiovascular health. Me country about talk way there my canon for and tea. Yeah,
it's okay.
Well, first, I wanted to talk a little bit about an outline of what we'll be discussing today. We have a lot to go through, so we'll get started. I'll talk a little bit about anatomy and physiology, some of the common cardiovascular diseases that we take care of, both peripheral vascular disease, coronary artery disease, cerebral vascular disease. We'll talk a little bit about some of the treatment options for these diseases, including evaluation that a physician might undertake. We'll talk about sleep apnea. And finally, COVID, something that is always at the forefront of all of our minds. I'll discuss a little bit about COVID and its effects on the heart. So the cardiovascular system is obviously made out of the heart. There's 3 layers of heart muscle that we call myocardium. When you look at the size of the actual heart, it's about the size of a human fist. So if you make a fist, that's about the size of your heart. It weighs about a pound, and it just illustrates the wonders of creation, that this small blood vessel is what keeps the blood pumping throughout our bodies. The cardiovascular system is made up of a series of blood vessels which carry blood from to the rest of the body through arteries, and then back to the heart through a system of veins. And this is an illustration of the cardiovascular system, with the heart at the center, and the red being the arteries that send blood to the different tributaries in your body, and veins that bring blood back to your heart. When you look at the heart structure itself, it's made out of 4 chambers, 2 in the top part of the heart, which are the atrium, and 2 in the bottom part of the heart, known as the ventricles. There are also 4 main heart valves that connect the top and bottom chambers, and also connect the bottom chambers to the rest of the body. The heart beats about 115 times each and every day. It pumps 1.5 gallons of blood per minute, for a total about 2,000 gallons of blood each and every day. And this is all automatic without you thinking about it. Your heart continues to pump blood throughout your body. It pumps blood again to every single organ in your body, your brain, your kidneys, your muscles, to allow you to walk each and every day. And typically in patients and people, when you're at rest, your heart rate ranges from 60 to 100 beats per minute, and obviously a little faster with exercise. So when you think about heart health, what are some of the things that will keep your heart healthy and your cardiovascular system healthy? Diet is definitely one of the main things. I won't go too much into it. I believe my mother will be given a talk about diet. Exercise is definitely very key. And when I talk to people about exercise, the important thing to think about is this doesn't mean that you have to be training for a marathon or go running every day for several hours. We're not asking people to be training like Lance Armstrong, but even simple walking at the end of the day after you have a meal, going outside and taking a leisurely stroll with your family members, a form of exercise which can be very beneficial. Running can be useful, riding a bicycle, even something as simple as walking upstairs instead of taking an elevator is a form of exercise that can definitely exercise your heart as a muscle and keep your heart healthy. Routine visits with your primary care doctor or other physician is also another way that you can keep your heart healthy. So heart disease. When someone says, I have heart disease, or when you hear about heart disease, what does it actually mean and why is it so important? Heart disease is a leading cause of death in the United States. So whenever someone unfortunately passes away, it's more likely than not that the cause is heart disease. And primarily what it is heart disease is a narrowing of vessels supplying blood to the heart itself. This impairs the heart's ability to pump blood to the rest of the body. That narrowing of blood reduces the supply of oxygen to the heart muscle, and it's oftentimes manifested as symptoms of angina, which is something that sometimes you'll hear, which is related to the reduction of oxygen supply in patients. Symptoms that people may feel when there is a reduction of oxygen supply is chest pain, pressure type sensation in your chest, difficulty breathing, especially with walking. Sometimes you can have pain in your jaw, and the pain can also sometimes go to your arm. These are all symptoms that are concerning and need to be evaluated. If you're having these symptoms, even if you're having them now and you've been discounting these symptoms, these are important things to identify. If you're having these symptoms, you should seek medical care and tell either your primary care doctor or another physician. When we're looking for patients that have heart disease, there's some blood tests that cardiologists such as myself may order. These blood tests can sometimes determine if there's possible damage to the heart muscle itself. If you also go to the emergency department, symptoms of chest discomfort, jaw pain, they may also run these tests. And these tests indicate if there's potential damage to the heart muscle and if further testing needs to be performed. Your cholesterol is also something that's important. High cholesterol increases the risk that you may have heart disease. So cholesterol is something that we order routinely. If you are having chest pain, shortness of breath when you walk, a stress test is a test that a physician may order. This is an example of a patient going through a stress test. Typically what happens is we connect them to an EKG machine to see what the heart rhythm does when they exercise. We'll check their blood pressure. And typically we get them on a treadmill machine and have them walk. And the reason behind that is when you're exercising yourself, your heart is working harder to pump blood to your muscles to allow you to exercise. If there are potential blockages, you may start having symptoms, either chest discomfort, or you may start having symptoms of shortness of breath, and you may have changes on your EKG with these symptoms. So stress test is a useful tool to identify who may have potential blockages and who may not. Further testing can be performed with what's called an angiogram. An angiogram is a test where we put catheters either through your wrist or through your groin. These catheters go in one of the main blood vessels called the aorta, which go all the way up to the blood vessels that supply the heart itself. When we're doing an angiogram, we inject contrast into these blood vessels. And this is an example of the two major blood vessels that supply the heart. There's one on the left side and one on the right side. When the contrast flows in the blood vessels, there shouldn't be any areas of narrowing. As you see on this right side, when the contrast goes through, all the blood vessels look like they're plump. But on the other, when you inject the contrast, they have narrowing. This is what we call coronary artery disease, a potential narrowing in one of the blood vessels supplying the heart. When you have that narrowing, that's what can cause symptoms of patients having shortness of breath or chest pain. An angiogram is a test that we do quite frequently on patients if there's concern that they may have blockages. So what is the treatment if someone has blockages? One is medications, such as blood pressure medications that dilate the blood vessels to allow more blood flow. Another potential treatment is placing a stent. As you see here, this is a blood vessel that has a narrowing, typically with cholesterol or other depositions that close off the potential area of blood flow. A stent opens up the blood vessel and allows blood to flow freely, and the stent stays there. So if someone has coronary artery disease and they have an angiogram, if there's a blockage, that blockage can be opened with a stent to allow more blood flow. Now, what if someone has multiple different blockages, or there are too many blockages where we can't put a lot of stents in? So that's where you hear of a procedure called a bypass surgery, where typically a cardiac surgeon takes a blood vessel from your leg, connects it to the aorta, and bypasses the area of block. So here, if there's a blockage, they'll put a blood vessel and bypass that blockage. This allows the muscle distal or past that blockage to still be able to get enough blood flow, store blood flow to that particular part of the muscle. So a bypass surgery is something that we do routinely in patients that have a lot of different blockages in different parts of their heart. The next disease that I'll talk about is peripheral vascular disease. And this relates to blockages in blood vessels supplying patients' legs. The lower extremity or legs are oftentimes more commonly affected than your arms. Again, these blockages reduce blood flow. And if you can imagine that the blood flow allows nutrients to supply the muscle, if your legs aren't able to get the nutrients that it needs, the muscle doesn't get enough oxygen, enough nutrients, and can cause symptoms of pain. And the symptoms that patients have depend on the location of the blockages and which muscles are potentially affected. So what are some of the questions that we ask patients to evaluate whether they have any sort of issues with peripheral vascular disease? So one is, do they have any pain with walking? How far can they walk before they have pain? Does the pain potentially wake you up from sleep? And are there any wounds on your feet that aren't healing? And typically what we see is patients will sometimes have wounds in their legs. And some of those patients may not even realize that they have those wounds. But the reason that the wounds don't heal is because that part of the leg does not get enough blood flow. And if it doesn't get enough blood flow, the ulcers and the wounds have a difficult time healing. Again, these are all questions that indicate a patient may have peripheral vascular disease, or at least needs further testing and further evaluation for this. Now, how common is this disease? About 10% of people worldwide have this problem, which is oftentimes more than 200 million people. There's about 413 admissions every year into the hospital here in the United States for this problem. And that's typically for infections that are difficult to manage, falls that patients can have because of pain, sudden pain in their limbs. These are all conditions that a vascular surgeon may intervene upon and treat patients for. So again, this particular condition is important if you are having any symptoms of this, to again seek medical care. Who are the patients that are most at risk for this? Typically, it's people that are over the age of 70 years old. other patients that are between the ages of 50 and 69, if they have a history of diabetes or prior history of smoking, they are definitely at risk for heart. You're at risk for developing blood blockages and blood vessels upon your legs, because oftentimes it's the same sort of mechanism that if you have blockages in one area, such as your heart, you may have blockages in other areas, such as your legs. Again, common complaints are leg pain, pain in your thigh, calf, or buttock, pain that's related to exercise, relieved by rest, and also pain at rest. These are all symptoms that patients that have peripheral vascular disease may have symptoms of. Some of the risks and complications of this condition, so chronic infections that can potentially be life-threatening, impaired mobility, an inability to walk around because of these symptoms. And patients can be at risk for losing either their limb or part of their limb when they have peripheral vascular disease. So the important thing is to catch this diagnosis early. You don't want to be in a situation where this particular issue is not addressed, and you run the risk where the blockage is too severe, and you run the risk of losing your leg or part of your leg. Cerebral vascular disease. So we've talked about blockages in your heart. We've talked about blockages in your legs. Now we want to talk about cerebral vascular disease, which is primarily blockages in the blood vessels that supply your brain. So typically when someone has cerebral vascular disease, they may have blockages in the blood vessel supply in their brain, and or either narrowing of the blood vessel. It could be a clot that forms, it could be a blockage in the artery, or it could be a blood vessel that has ruptured suddenly, causing bleeding in the surrounding tissue. Now, one of the most common symptoms and diagnoses that we see in patients that have cerebral vascular disease is a stroke. I think, unfortunately, we've had patients in our community that have suffered a stroke. So just to bring everyone on the same page, what exactly is a stroke? So it's a sudden reduction in blood flow to part of the brain. The symptoms that someone may have may be related to affected brain tissue. And patients can have either short or long-term effects. Some patients have symptoms that suddenly resolve after some time. And these patients are typically thought to have a TIA, or transient ischemic attack, which means they have all the symptoms and manifestations of someone who had a stroke, but their symptoms resolve and get better over time. Now, even though it's good that their symptoms resolve, it's important to remember that if you have a TIA, that's a warning sign that you may potentially have a stroke, or you're at risk for developing a stroke in the future. So with these particular diagnoses, specifically a transient ischemic attack, it should indicate to the patient that we need to start instituting the necessary measures to prevent you from having a full stroke in the future, especially a stroke that can potentially cause lasting effects. This picture is identifying a patient who is having facial droop and is likely having a stroke. So what are some of the symptoms that you need to think about? So facial changes is one part of someone's face. Weak, is it drooping? And that's typically because the muscles are not getting enough blood flow to allow them to have a normal facial expression. What about unsteadiness? So part of your brain dictates how you are able to stand or sit or orient yourself in space. So if there are any issues with blood flow to that particular area, you may feel unsteady on your feet and aren't able to stand up straight or walk. What about issues with speech? So garbled speech, you're not able to understand someone very well. They can't understand what you're saying or process any information or speech that you're speaking. Arm weakness, leg weakness, vision changes. These are all important things to think about, that if someone is having any of these symptoms, they need to seek urgent medical care. The important thing is, when there's a blockage, time is of the essence. The longer you wait or the longer time passes between the initial blockage until when that blockage is addressed, that can lead to lasting or long-term side effects. So time is of the essence. If you have these symptoms, you need to seek medical care almost immediately. Some of the imaging that you may have done at the hospital, a CAT scan is typically the initial study to look for any bleeding or anything. An MRI gives more detail and can be performed later. This is a patient who had a stroke on the right side of their brain. And you can see that this area is a little darker than the other normal tissue. This is a CAT scan. And on an MRI, again, you see this particular area is darker. On this particular type of MRI, it's lighter. This indicates that this whole area of their brain is affected. Again, a TIA or a mini stroke, patients can have the same symptoms of a stroke, and the difference is that blockage isn't permanent. It forms and then can sort of leave and go elsewhere. But with the stroke itself, that blockage becomes permanent and blood isn't able to flow. With the TIA, the blood is able to flow again. So you may have symptoms and those symptoms go away, resolve. Patients don't have any long-term side effects. The symptoms resolve within a short period of time. And again, I want to emphasize that this is a warning sign. If you have these symptoms, that means that you're at risk for developing a stroke at some point in the future. What should we do? Benjamin Franklin coined the sort of popular term of an ounce of prevention is worth a pound of cure. Again, prevention of these diseases is the most important thing that we can do. Again, this isn't in the scope of this talk, but prevention is always key. But what if we're not able to prevent it? What are some of the things that we can do to reduce the risk of you having these diseases? So blood pressure. Blood pressure is an important thing that we all need to think about. So when you're looking at a blood pressure machine, the top number is known as your systolic blood pressure. And that is the force of blood being pumped throughout your arteries. That's the top number. The bottom number is known as your diastolic blood pressure. And that's the blood pressure in the blood vessels in between heartbeats. So anytime you're talking about a blood pressure, there's two numbers, a top and bottom number. The normal numbers, or the numbers that we strive for, are a systolic blood pressure less than 120 and a diastolic blood pressure less than 80. So if you see anyone or you have a blood pressure machine at home, or someone tells you that their blood pressure is higher than these numbers, someone that needs to talk to their primary care doctor, talk to a cardiologist about why their blood pressure is high and if they need to be on medications or have their medications adjusted. Hypertension is a diagnosis that is common. I think we all know what it is. It's an elevation in your blood pressure that requires treatment. Again, normal is less than 120. Elevated is 120 to 129. Above that is typically what we think of stage 1 hypertension, stage 2 hypertension. And typically, if your blood pressure is greater than 180, that is extremely dangerous. You can have a stroke, you can have a heart attack if your blood pressure is so high. High blood pressure or hypertension can increase your risk of cardiovascular disease, specifically the things that we've talked about. Typically, systolic blood pressure is what we look at when we're talking about hypertension, but it's important to understand and think about that if the lower number, if the diastolic number is also high, that can be indicative of hypertension and may need to be treated or at least evaluated in some fashion. Now, what are the typical medications that we use for treatment of blood pressure? These are medications that many of us have heard of, diuretics such as hydrochlorothiazide, spironolactone, ACE inhibitors, and these are typically medications that end with pril, like lisinopril and enalapril. Angiotensin receptor block ARBs, which are medications that end with artan, like losartan, candesartan. Oftentimes we use ARBs in patients that don't tolerate ACE inhibitors. The most common side effect that are on ACE inhibitors is a cough. And that can happen at any time when you're on that medication, not necessarily when you first start that medication. But if you have a cough, your doctor may switch you from an ACE inhibitor to an ARB so that you don't have that nagging cough. Beta blockers are another medication that we use. These end with LOL, such as metoprolol, orbetalol, labetalol. Hydralazine is another medication that we use. Calcium channel blockers, such as diltiazem, nifedipine, and amlodipine. These are all different classes of medications that a physician may use. Sometimes a patient may need one medication, sometimes they may need 2 or 3 to control their blood pressure. But what I wanted to do is outline the types of medications in case you know someone that are on them or you're on them, to understand what they're for and how they're used. The important thing with medications for blood pressure is you need to take them daily. Now, oftentimes when someone comes to a doctor to be seen, whether you have a cold, a cough, or something else going on, the thought is that you'll have symptoms or some issue. A doctor will prescribe a medication, you'll start taking the medication and you'll automatically start feeling well. If you don't take the medication, then you won't feel well. So usually what we notice is the medications are correlated with how we feel. The problem with blood pressure is you probably won't feel any different whether you take the blood pressure medication or not. So this is what oftentimes we see, that patients will say, well, I feel perfectly fine, I don't need to take the medication. If they don't take the blood pressure medication, they don't check their blood pressure, they may be walking around with a blood pressure of 160, 170 without symptoms that indicate to them they need to take their blood pressure medication. So if you have high blood pressure but diagnosed with hypertension, the important thing is to take your blood pressure daily and also be adherent to the medications, even if you don't think it's doing anything because you don't feel any different. It is working because it's keeping your blood pressure down. And if you're taking your medications and your blood pressure is still high, that means we may need to increase the medications to control your blood pressure. Cholesterol. So cholesterol is oftentimes something that we see patients with high blood pressure, high cholesterol. There's a blood test that we can perform. Total cholesterol is one of the labs that we'll see with the blood test. Typically should be less than 200. HDL, which some of you may have heard of, is your good cholesterol. Your LDL is your bad cholesterol. Triglycerides. And oftentimes, these tests are performed while fasting. And to weigh a test up, any so would deep fufu and katekwan sana wokoye wo cholesterol because wo yesa wo cholesterol no be high. The medications that oftentimes we use to treat high cholesterol are statins. So simvastatin, pravastatin, or torvastatin. One thing to remember with these medications is that you can have some side effects such as muscle pain. So if you have pain in your legs, it's important to tell your physician that you have this. They may switch you to a different statin medication. There are other medications that oftentimes we use, ezetimibe, fibrates. Some of the newer agents are what we call Pcsk9 inhibitors. These are brand new or newer medications that we use for patients with cholesterol. They can be expensive, so typically your insurance company has to approve it. But these are oftentimes used for patients who are on statins, but for whatever reason, the statin isn't enough to control their cholesterol, or they've tried all sorts of different statins and they still have a lot of symptoms, and their cholesterol is still really high. Diabetes. So there are two types of diabetes. Type 1 is usually diagnosed as a child. Type 2 is the most common one that we see. That oftentimes is related to obesity. Patients that have diabetes are treated with either medications or insulin administration to keep their blood sugar low. Testing is performed either with a fasting blood sugar greater than 126 indicates that you have diabetes, or any random blood sugar over the 200 indicates you have diabetes. Your hemoglobin A1C is a lab test that your physician may check, and that just gives us a sense of what is your blood sugar been on average over the last 3 months. Red blood cells last for about 3 months, so this hemoglobin A1C. Sugar affects the blood cells in a certain way that you can draw this test and see what is a patient's average blood sugar been for the last 3 months. And this is typically a blood test that we use to really get a sense of a patient's blood sugar over a longer period of time. Do you snore? So snoring is something that's quite common, as depicted by this image. Either your wife or your husband may snore, which can cause issues when you're trying to sleep. They may be sleeping soundly, but you may be having trouble sleeping because of the snoring. So what is snoring? So snoring is a vibration of soft tissues in your airway when you sleep. And that's typically related to narrowing or closing of the airway. So in this image, when your airway is open, air is able to flow freely, but when your airway closes off or narrows, that's when you're able to hear someone snore because the air doesn't pass freely and vibrates the soft tissue as it's going through. How common is snoring? About 44% of males and 28% of females may snore at night. So why does it matter? So patients who snore are more likely to have sleep apnea. This is someone that has sleep apnea and it has a CPAP machine to help them when they sleep to force air to prevent them from snoring. So when the airway closes, you can stop breathing suddenly. Sometimes people feel a sensation where they wake up suddenly feeling like they're not able to breathe. And that's typically because the airway has closed off. You're not able to move air when you breathe, and you wake up gasping for air. So if patients have sleep apnea, what are some of the ways that how do they feel? Oftentimes they may feel fatigued, tired, sleepy during the day. They may not have any energy. If you sleep with your wife or your husband, you may ask them whether you snore because you may not realize that you snore. These are all symptoms of sleep apnea. It's important to identify this because it is a condition that is underdiagnosed, and patients need to be evaluated for this if they do have sleep apnea. Why is it so important? So fatigue is a cause of about 250,000 motor vehicle crashes per year. About 20% of all serious crash injuries are related to fatigue and lack of sleeping. One of the ways that they've identified this is the most common time, or the time that people are more likely to have an accident, is usually related to daylight savings time, when you lose an hour. So typically after that hour that people lose, that you're more likely to have an accident because of the potential lack of sleep with that hour loss. The reaction time after 24 hours of not sleeping is similar to being intoxicated. So it is really important to recognize that fatigue is important. And if you're driving fatigue, you could be posing yourself and other people at risk. This is a picture of a common road in Boston called VFW Parkway. And this is actually leading away from the VA hospital where we often did our rotations. And I bring it up because there was a resident that actually unfortunately died coming back home from a 30-hour shift. Obviously, they hadn't slept at all that night. The road is winding. They were extremely tired. And unfortunately, they drove onto oncoming traffic, had a head-on collision, and died because they were tired. So if you're tired, if you work nights, for example, if you are feeling fatigued, pull over, sleep for a few hours, because it's really important, if you are feeling tired, to not continue to drive, because you are putting yourself at risk. Sleep apnea is typically manifested as patients who have periods when they sleep where they either stop breathing or they're not able to take deep breaths. These episodes can last anywhere from 10 seconds to almost 2.5 minutes in duration, where someone is either not breathing or not breathing as strong. This can happen 30 to several hundred times per night. And it's thought that sleep apnea is undiagnosed in about 80 to 90% of affected individuals. Again, this is one of the most common underdiagnosed conditions, because if someone snores, it's thought to be just something that happens, but not related to sleep apnea. Sleep apnea is not something that oftentimes we'll think about related to snoring. How common is it? About 15 to 30% of males, 10 to 15% of females have sleep apnea. Close to 1 billion people worldwide have mild to severe sleep apnea. About 1,100 million have moderate to severe sleep apnea. It is more prevalent in African Americans. Asia and the United States have similar prevalence, and that prevalence increases over time, and it correlates with an increased rate of obesity. So obesity is directly related to sleep apnea. What are some of the symptoms? So daytime sleepiness, fatigue, feeling tired, low energy, poor focus. If someone is at church and they fall asleep easily, you may want to ask them if they snore at night, because that's something that sleep apnea could be undiagnosed in that particular patient. Patients can have snoring, choking, gasping during sleep. Morning headaches is a common symptom, where if you have these, you need to think about a sleep apnea test. This is a sleepiness scale, which looks at the likelihood that you may fall asleep doing any of these particular activities, such as sitting, reading, watching television, sitting in a public place, as a passenger, a car, laying down. Your chance of dozing, you rate it from 0 to 3. And if your 3 being your high likelihood of dozing, 0 being a 0 chance of dozing off. If your score is high, you may need to talk to your primary care physician about sleep apnea. Some of the risk factors for sleep apnea: older age, at plateaus in the 6th and 7th decade, Again, male gender, obesity, a 10% increase in weight is associated with a 6-fold increase in the risk of sleep apnea. Moderate to severe sleep apnea, again, in men, 11% of patients have moderate to severe sleep apnea. 21% of patients who are obese or overweight have moderate to severe sleep apnea, and 63% of obese patients have moderate to severe sleep apnea. The same holds true for women. If you're overweight or obese, you're more likely to have sleep apnea. A sleep study is the first test that can be performed in someone who has sleep apnea. So the patient sleeps while they're connected to various monitoring devices. There's an EEG that evaluates brain waves. They're connected to an EKG to identify any abnormal rhythms while they sleep. There is an option for home screening. That's just a machine that you're able to use at home. It doesn't replace a sleep study, but sometimes if there's a backlog for patients that need a sleep study, you can do the home test to either identify if you're at risk or potentially have sleep apnea, or if you don't have sleep apnea, and then the next test, if you are at risk for sleep apnea or it indicates that you have sleep apnea, you can do the full sleep study. Some of the associated medical conditions in patients that have sleep apnea: congestive heart failure, fibrillation, TIA or stroke, hypertension, renal disease, lung disease. These are all associated medical conditions that if you have sleep apnea, you're at risk for, specifically untreated sleep apnea. Again, highlighting the importance of identifying if you have symptoms that may indicate sleep apnea, seeing a physician and getting tested for sleep apnea, and getting treated if you do have sleep apnea. We'll talk a little bit about coronavirus. Again, it's the most common medical issue that we're often dealing with currently. It's a single-strand RNA virus. It's in a similar subgenus as SARS. People remember, so SARS was found in November of 2002. There was an outbreak from 2002 to 2004. It caused a severe acute respiratory syndrome, coronavirus. There were about 8,000 infections worldwide and about 774 deaths. What's unique is when you compare this to coronavirus, that definitely was an issue back then, where a lot of people were being infected with about a 10% death rate. But when you compare it to coronavirus now, coronavirus is far more virulent with a lot more people being affected and a lot more deaths. Similar to SARS, but a lot more severe currently. So how does coronavirus enter cells? So there's a protein located on the virus which binds to a receptor in the human body. That binding leads to virus entry into the cells. That's how coronavirus infects individuals. So typically what happens is there's a stage where patients are asymptomatic, and this is typically the most dangerous stage. This is the stage where oftentimes patients don't know that they have coronavirus. They're interacting with people, they don't have symptoms, and they're unknowingly passing on the virus to other people because they don't have symptoms. This is also a time where it's a highly infectious. Detection is performed via a nasal swab, and that's typically how the virus is introduced into someone's cells through passage. The stage 2 of this disease, invasion and infection of the upper respiratory tract. This happens in about 15% of cases. And this is when your body starts developing an immune system response where it tries to fight off the virus. Again, this is about 15% of patients. The next stage is when it affects the lower respiratory tract. and leads to progression of disease. At this point, your body mounts a significant immune response trying to combat the virus. And that immune system response is typically what's associated with some of the issues and pathology related to coronavirus. This is when you can have damage to the lung tissue, leading to difficulty breathing. You can have other effects on the heart. This is when patients oftentimes present, they're having difficulty breathing, their oxygen levels are low. They need to come into the hospital because of these issues. And ultimately, they may start needing to be on a respirator or a ventilator because of the damage to the lung tissue. About 5% of cases. Now, what are some of the treatment options and treatment modalities that we employ? So steroids is one of the common treatments when patients come in with coronavirus. Steroids are oftentimes a mainstay of treatment. When you look at mortality in patients that have a month after their initial diagnosis and treatment, they're in the hospital for a shorter period of time. There's reduced progression to require mechanical ventilation. There's convalescent plasma is also another treatment option. That's patients who have had COVID, who have recovered. Typically what happens is your body forms antibodies against it to prevent or to fight off the virus the next time that you have that you're infected with coronavirus. So typically what we do is we get plasma from these patients, and the plasma has the antibodies, and you could administer the plasma to other patients that have COVID, and giving them those antibodies helps treat their COVID illness. Typically, patients that get convalescent plasma have a lower risk of death. Remdesivir is also another common treatment. It prevents the virus from replicating. Viral replication is an important key to the virus affecting and continuing to affect patients and prolonging the disease. So remdesivir halts viral replication and has been shown to be quite beneficial in treatment of patients that unfortunately have coronavirus. What are some of the cardiac effects of coronavirus? So this is definitely something that we see often. So what happens when you have coronavirus is your body starts an immune response to coronavirus. And when your body initiates that immune response, the goal is for it to attack the virus. But unfortunately, sometimes what happens is the virus has certain proteins on the surface that mimic your own native cells. And the virus does this to basically go around your body and not be noticed by your immune system. So sometimes what happens is your body's immune system attacks its heart because it thinks the cells of your heart muscle are actually cells from the virus. So this immune response increases the risk of blood clots, risk of damage to the heart muscle, which is manifested by myocarditis. Patients can have long-term injury to the heart muscle from this. Other cardiac effects of COVID are arrhythmias. So as a heart rhythm specialist, this is something that we see frequently. Patients can have more arrhythmias such as atrial fibrillation, atrial flutter. Palpitation is the most common symptom of patients that have COVID, and especially in the post-COVID realm. So oftentimes patients, their initial presentation could be palpitations. 7 to 17% of patients with COVID may present with symptoms of either feeling their heart racing, feeling palpitations. There's a recent case a little more than about a year ago that you may or may not heard. It was a gentleman that played basketball at the University of Miami, University of Florida. He was a college basketball athlete. He had no prior medical issues. He actually contracted COVID in the summer of 2020. It was early on in the basketball season when he was playing after contracting COVID. He had recovered, everything was fine, he felt well. And unfortunately, he collapsed suddenly during a basketball game. He was rushed emergently to a hospital. Initially, during his presentation, he was intubated and sedated, and ultimately he was diagnosed with myocarditis. And again, myocarditis is damage to your heart muscle because of your immune system response in an attempt to fight off some virus. Typically, it's viruses that we've known for some time, but most recently what we're seeing is it could be viruses specifically related to coronavirus. So myocarditis is definitely something that we see in patients who have had COVID. And the important thing to remember is if you've had COVID, it's important to make sure that you see physicians routinely. Sometimes there are some changes on your EKG or other things such as an ultrasound that can indicate whether you have myocarditis. So these are all things that are important to see physicians routinely. The most important way to prevent spread of the virus is social distancing, washing your hands, sanitizing frequently, seeking medical care if you're not feeling well. One of the things that we saw with the pandemic is patients are scared of coming to the hospital. The main concern is patients that have COVID go to the hospital. If I go to the hospital for something else that may not be related to COVID, I may get COVID. Again, it's important whether you have COVID or not, or you think you have COVID, it's important if you do have any medical conditions that you do seek care in the hospital. Hospitals have important structures to reduce and essentially eliminate the likelihood of someone getting COVID by actually coming to the hospital. So I think that's why it's important that if you do have any medical conditions, any issues, especially some of the things that we've talked about, cardiovascular disease, cerebral vascular disease, peripheral vascular disease, if you have any of those symptoms, it's important to seek medical care either in the outpatient setting with a primary care doctor or cardiologist, or even come to the hospital. Obviously, if you are having symptoms of COVID, such as fevers, chills, loss of taste or smell, cough, it is important that you seek medical care right away because you may be a candidate for some of these treatments, such as steroids, plasma. The difficulty is if you present too late after you have symptoms, some of those treatment options are no longer available to you. So it is important to catch it early. Again, vaccination is important, either your initial or booster shot. One of the questions that I get from patients is, I hear a lot of things about issues with the vaccines or possible side effects. What should I do, or should I still get the vaccine? The important thing is the vaccine does reduce the risk of you getting COVID, reduces the risk of you being hospitalized with COVID, reduces the risk of you dying with COVID. You're more likely to have side effects or adverse issues when you get COVID than it is for you to have issues with the vaccine. So the vaccine is definitely something that we recommend as a medical community to reduce the risk of spread and also reduce the risk of you getting sick from COVID. Now, just to summarize, there's several diseases of the cardiovascular system, which we outline. Coronary artery disease, which is blockages in the blood vessels supplying the heart, causing a heart attack. Cerebral vascular disease, which is blockages in the blood vessels supplying the brain, causing a stroke. Peripheral vascular disease, which is blockages in the blood vessels supplying the legs, which increases your risk of leg amputation or limb amputation. The important thing to do is have routine care and routine office visits with your primary care doctor, checking to see, do you have high blood pressure? Do you have diabetes? Is your cholesterol high? If you have any of these conditions, making sure that you're getting treatment, you're continuing to take your medications daily, even if you don't necessarily feel different when you're on these medications. Diet and exercise reduces the risk of having any of these cardiovascular system diseases. It's important to discuss with your doctor if you have these symptoms. I wanted to outline some main symptoms that you may feel if you have any of these conditions, so that if you're having these symptoms, you can alert your primary care doctor or your cardiologist. Sleep apnea is a forgotten diagnosis, something that a lot of people don't think about. If you snore, if you feel tired during the day, even after you've slept for a full night, these are all things that you need to think about and talk to your doctor about if you have these symptoms. COVID does affect your heart from an arrhythmia standpoint to possible abnormal heart rhythms, specifically those that could potentially be life-threatening and deadly. If you're having symptoms of COVID, it's important to seek medical care. It's important to stay away from large crowds, washing your hands frequently, sanitizing your hands, wearing a mask, getting vaccinated and getting the booster shot if you haven't already. These are all things, steps that you can take to reduce the likelihood that you'll get COVID and you'll spread COVID to your loved ones. So thank you. Wanted to see, I think we'll open up the floor now for any questions that people may have.
Okay, there was a pa AJ, additional the amayen. What can be sleep apnea, diabetes, hypertension, chest pain, stroke, coronavirus, peripheral vascular disease. They say, and all the alphabet, Yame in shroud. Yame, ma, Yadu Suno in some Bisahodua, Yanso Yawo. So that Diana no, ubits me up a sa, our chat no so me who my fro. Ubits me so a type of question no about chat no so, you be who ya can kind. Na answer question no amount. And now I say, the on per se, Ubia Musibia Ubusa question, I be sa. Ubits me ascend a question no amame. And now I say, Obesandino, I'm a doctor on a private message ho, in Sabeka, Nasa me, na ya read it. Na doctor Suno et me answer, amare. With the answer, I'm reading Fred the power, what didn't I pay and Sano? Will be questioning about her by 10 parts, and we will say we are not Mr. Diabo also the audio Abba. Dog, the question was say coronavirus and the hard conditions I can. So be in your coronavirus. Now what treaty Nako and now say you can when who's intimacy be about when your coronavirus now. A bit me early dino to permanent heart condition be na. So sada tia dia na obetimi aye se de be ya that we no na kuma enkofa problem be emre no.
Yeah, so coronavirus is definitely associated. So patients that have underlying cardiovascular disease typically can or often more sick if they get coronavirus. So if you have high blood pressure, diabetes, you're more likely to come into the hospital, be admitted to the hospital when you have coronavirus. You're more likely to be sicker if you have coronavirus. You're more likely to be intubated or placed on a ventilator if you have coronavirus. So all of those underlying medical conditions, specifically cardiovascular disease condition, increases the likelihood that you will become more sick with coronavirus. So that's why it's really important to avoid and make sure that you don't contract it by taking the necessary steps, and also to get the vaccine. To answer the question about some of the long-term side effects, so there are definitely long-term side effects of coronavirus that can affect both your blood vessels. So patients can have heart attacks. If they get coronavirus, they can have heart failure where their heart function becomes abnormal. So these are all things that can definitely affect the heart. And again, the most important way, the best way to avoid it is, one, to not get coronavirus first, or if you do, is to make sure that you're getting the appropriate care, seeing your primary care doctor, seeing a cardiologist, coming into the hospital for care if you do get coronavirus.
Okay, that was you say the paradigm question and bear no at here. And then Mr. Jabo, Pacho with me Akasa.
Yo, imagine Dr. Edamasepa. Now, Doctor, we will send me booster question. If high blood pressure, no. Obi or na or high blood pressure or that medication. So we also cry no on that medication. So, but what test here? It be a slow DNA. I was say you be 120. Unya, if so are very close to it, and I say, and yet it be something a year a so. But as here the no 10 be I'll be checking out a was so it be a 90 plus near the also Casano say oppression won't mean control is I was say doctor now or medication either so be increase amount. Until they may say me who says Secobasa and no danger woman and I feel so no. Once I through the any year pomo the no time be any more problem no. Still I was all my doctor increase with medication and
Okay, so what we had talked about was systolic and diastolic pressure. So your question is, if your diastolic pressure is high, what should you do? Should you still talk to your doctor? So typically what that means is with your diastolic blood pressure being high, that's the point when your blood vessels relax in between heartbeats. So if your blood vessels should relax and the pressure is still high, what that usually indicates is there's some stiffening or hardness in those blood vessels. That's why they're not able to relax and the blood pressure is not low. That can sometimes be related to cholesterol buildup, plaque buildup. So, I think even though the diastolic number is a number that we don't always think about, if it is high, that's something that you still need to talk to your doctor about why is it high? Do I need to increase some of your medication? Do I need to make sure my cholesterol is well controlled? And typically the other thing in those circumstances is diet, which Dr. Yaw Adjei-Poku will talk about tomorrow. Exercise, all of those things allow the blood vessels to relax. So that the lower number, the diastolic blood pressure will become closer to normal. So if your diastolic blood pressure is still elevated, there are things that you can do to bring that number down. And that's either talking to your provider, and also diet and exercise will make sure that that lower number can be lower.
Oh, it was using Mr. Jabo, what no ase. And maybe a question, a kind of question about what chat so na we are na ba in DAGOT no. Now the question no about that go be we say is bees good for your heart?
Okay, so my mom will talk about diet tomorrow, so that might be a question that we can defer until tomorrow.
Okay, actually, Dr. Mrs. Adjei-Poku, need remember Nyamboa Saturday area. Yeah, well, we have question, Nyamboa Saturday afternoon, Bunya a whole answer. And yeah, the idea Jotino, Patrick will have question.
So, Imam, that's just associated to from Denver. Doc, wait here, that's a party presentation. And Dr. Abna Usu from Pomi, who said the importance of, say, getting routine cleanings near you. No matter who said a lot of patients are be some crown or more be cardiologists and be orthopedic doctors. Nekachomo say, or more cleanings almost answer. Maybe on and some of my heart surgery. Think a doctor bet me a boy and woman. The importance in TS, ye DS, ye sing any senior baya, Sabia, ukonya heart problem and yankopon fasama. Send your beya, yen put two and no on hold just so you can go and get a teeth cleaning or any clearance answer. Disobey me about mama who a chief who the importance of say Uber Kwakoya was saying ejuma as what Dr. Usu was saying, how it relates to the heart. The other question is it still important, say, pre-medications as antibiotics, with maybe people with heart murmurs or anything with heart problems, be an be a heart surgeon, are we still pre-medicating them with the antibiotics before any, let's say, oral oral cleanings be that induced bleeding?
Yeah, so oral care is definitely important. One of the main reasons from a cardiovascular standpoint why it's important is because certain bacteria that grow in your mouth can get introduced in your bloodstream, and those bacteria can adhere to some of the valves and cause infections in the valves, what we call endocarditis. So it's really important for oral hygiene for patients that see their dentist routinely, because oral hygiene is definitely related to the risk of cardiac issues, specifically endocarditis infections in the bloodstream that can then go to your heart, causing endocarditis. So definitely oral hygiene is something that's important. From a cardiovascular standpoint, sometimes when you have either procedures, dental procedures, we want to make sure that from the cardiovascular standpoint, you're optimized, that you're not having a lot of discomfort. That reduces the risk of complications and issues to whether it's dental cleanings or any other testing, such as colonoscopy or other procedures that you may have. It's important to make sure that from the cardiovascular standpoint, you don't have any issues. To answer your question about routine prophylaxis, so that's actually something that has changed over some time. Historically, what we thought is that anyone with any sort of heart murmur at all, we need to give them routine prophylaxis prior to dental cleanings, again, because of the concern that they may develop endocarditis. So that's typically what we thought of as bacterial endocarditis prophylaxis. Now what we're realizing is obviously antibiotics are not benign, they cause resistance and things of that nature. So typically with the current guidelines, the only patients that need prophylaxis are typically those that have valves where they're at higher risk for if they were to develop endocarditis. If you have a murmur, you don't need prophylaxis just for a murmur, but typically if they have prosthetic, mechanical, or even some of the newer percutaneously implanted valves, those are typically the patients that need prophylaxis prior to dental cleanings.
Thank you so much.
Yeah.
Can I answer? Na obi pese okasa nipa mbakwa de kasa. Okay, so nipa no enye ready e beto aso. Dog yanko chat no so no obi bisa say relations between diabetes ne coronary arterial disease ewo. Diabetes ne coronary arterial disease.
Yeah, so typically when someone has diabetes, we assume that they have coronary artery disease. So the thought is that if someone has diabetes, we treat them as if they have coronary artery disease. So we put them on statins, specifically high dose statins. We make sure that their blood pressure is well controlled. If they have any symptoms of chest discomfort or shortness of breath, we make sure that we've done the appropriate testing. So it has diabetes, the assumption is we treat them as far as the risk as if they have coronary artery disease, or their risk is the same as someone who has coronary artery disease. So that's the association, that typically if you have diabetes, we assume that you also have coronary artery disease, and we treat you accordingly, especially with medications. And if you have any symptoms, what we do.
Dog get was it. Obisi question or no.
Hello. Dr. Adjei-Poku, let me answer question back.
I'm patcho with answer, dog.
Obi bisa question about beats. And I'm person here no beats contain nitrates. A chemical be a blood vessel dilate. Enti sadi awfa beats na so nya nitrates and not me my blood pressure a bad down. And it me a drop of blood pressure. And yeah, a natural way you did treat blood pressure. Manuas.
Yo, dog get was it for so about this question am I and met was answer the next question or no. Dog will be a bisa the effect of numbness, and then causes numbness, no.
Yeah, so there are a couple of things that it could be. Numbness could be related to the nerves in your arms or your legs, and that oftentimes can be related to patients that have diabetes. So patients that have diabetes typically have higher blood sugars. Glucose can be toxic to nerves and other cells, so that can cause numbness. So that's actually something that commonly we see with patients that have diabetes, can develop numbness several years after they develop a diagnosis. And that's when they may hit their leg and they may get a cut and they don't even realize because they have numbness, they don't feel certain things. So that's definitely something that patients can see. Also, peripheral artery disease, if you have issues with the blood vessels, that can also affect the nerves and can cause symptoms of numbness. So, if you have some of those risk factors that we talked about and you're having symptoms of numbness, that is also something that typically we want you to ask your doctor about.
Is any panel what a question or I say? Obi able to say the large artery supply or heart no say emfansia. Dear bit me at Tuni Pakro.
Yeah. So the large artery that supplies the heart is called the LAD, or your left anterior descending artery. Oftentimes it's called the widowmaker, meaning that if you have a blockage in that could potentially lead to death because it supplies a large area of your heart. So again, coronary artery disease, specifically being blockages in some of the blood vessels. You can have blood blockages in that main blood vessel, could be others. So, there's no way to know which blood vessel is going to be blocked. So that's why it's important to instill these things like diet, exercise, watching your blood pressure, cholesterol. But blockages can lead to heart attacks. Typically, when you hear of people dying suddenly, that's usually a blockage or a heart attack that blocks off some of the blood vessels. And when the heart muscle doesn't have blood flow, you are at risk for developing these lethal or life-threatening arrhythmias that could potentially kill you. So that's when you hear of people dying in their sleep suddenly. So it's important. You can have congestive heart failure because even if you have a blockage and it's opened up, that part of the heart can be damaged or dead for a long time, and it won't recover with permanent damage. So you can have congestive heart failure, recurrent hospital admissions. So those are some of the symptoms and issues and side effects when you have blockages, specifically in that main blood vessel.
Dog, it was it. Obi so question obisa. Was it adentina war high blood pressure? In addition to blood pressure drill, the doctor asama aspirin account.
Yeah, so that's an interesting question. So similar to the bacterial prophylaxis, where previously we would give prophylaxis to everyone, aspirin is a medication that historically everyone was given aspirin. You would see commercials on TV for Bayer aspirin, that if you're over a certain age, you need to be on Bayer aspirin. What we're realizing now is if someone doesn't have known coronary artery disease, we're less likely to recommend aspirin, mainly because there are some risk of aspirin, particularly bleeding. So the thought is that unless you have a clear reason, a clear indication for aspirin, typically we don't just say everyone should be on aspirin, because if you do that, you'll have more issues with people having bleeding compared to the beneficial effect of aspirin. Now, granted, if you have coronary artery disease, your doctor will most likely recommend that you're on aspirin, but we don't routinely just as a blanket statement say everyone should be on aspirin.
Can I make a contribution?
Doc, quite a.
I think the other situation is high blood pressure also increase your risk of stroke. And so if your doctor is concerned about your risk of stroke, then they can give you an aspirin as a preventive measure, in addition to give you medication to bring your blood pressure down. So that may be the reason. Yeah.
The reason. Oh, okay. Doc, yeah, there was CP. Now, Mesa Akko chat no so. Obi bisa about a hole in heart. Say akwada ya one hole in heart no. Later in the later years no. Binya effect bi on so ana.
Okay. So maybe I'll have my dad answer this since he's a congenital heart specialist.
It depends on the size of the hole in the heart. There's a small hole in the heart that all of us had when we are developing the womb, and that closes most of the time right after birth. Then there's another type of hole in the heart which is due to structural abnormalities where the heart does not form correctly. And depending on the size of that hole, that would determine whether you are going to have problems or not. If it's a large hole, then generally we recommend that we address that right after birth or a few years after birth. If it's a small hole in the heart, then sometimes we watch you over time because sometimes it can close as you age. So it depends on the size of the hole, and that would determine whether it's going to impact upon you negatively or not.
Yo, Dr. Edawase. Hey, Doc, my follow-up question. I will nipa question yi so. Bi se be boa de or busa question no. So suppose is there ipa no so dan the whole no issue. And the catcher say e betua. But it no sa no or say later on or call back to the doctor no. Near checking me who say a tuya na say so far as I can say e betua there. And why no.
Yeah, it's good to have a follow-up. I mean, from time to time to make a determination the hole, one, it has closed, or if it's getting bigger, even though sometimes the hole will close over time. Sometimes too, it can enlarge over time. So yes, it's a good idea to be seeing the cardiologist on a regular basis. And we assess that with an echocardiogram to decide if the hole is either the same, is it smaller, is it getting bigger? And then depending on the effects of the hole on the heart, of course, that is determined by the size. We'll make a determination if we need to do something or not.
Doc, it was a contribution at the boy edition. And you come back to the next question. Next question about palpitation. The person who gain a cause palpitation. Na enyame bi wo ho ma betimi aboa ama obi a nakoma ebo ntentem no eso atia na.
Yeah, so palpitations are often symptoms of feeling your heart racing that could be related to an abnormal heart rhythm. There aren't any particular medications that I would say would help. Sometimes there are medications or there are foods that we say people should avoid. So sometimes if they notice that when they drink a lot of coffee, or caffeine, they're more likely to have that. Typically palpitations, if you have those symptoms, there's a monitor that you can get that will tell us if you're having an abnormal rhythm or not. That's usually the first step in evaluating palpitations. But typically, there's no particular foods aside from the standard heart healthy foods we recommend.
Doc, that was it.
Palpitations simply means an awareness of your heartbeat. Sometimes that may also be normal. For all of us, it's normal for your heart to go fast if you are in situations of danger or you're under stress. So if and sometimes depending on certain physiological conditions, if you have a fever, it is normal for your heart to beat fast. If you are dehydrated, your blood pressure is low. If a lady is, for instance, having their menstrual bleeding, they may have a heart rate as the body responds to the blood that they are losing. So that may not be abnormal per se. So it's only when the rapid heartbeat is not normal that we will address.
Doc, wait, my message follow up. I want to question so many Coronal. Now, I say when it comes to normal, you follow up. Now, I know as in the panel on the medical side, how the person knows this palpitation is normal for me, or not say any normal, or say me who me doctor. So which are boy a crowd on the maybe your next question also.
And that's what you said, that you see your doctor and then we can have you wear a rhythm monitor to try and catch the rhythm or your heartbeat and see exactly what your heart is doing at the time that you are having the palpitations. And based on that information, make a determination. Maybe this is a normal fast beat that you're getting because you are in pain, you're having anxiety or something, or it's an abnormal fast rhythm. Then we would make a determination based on that rhythm monitor and decide if we need to treat it or not.
Oh, that was it. And the next question, about pacemaker. Probably so who and for so being a pacemaker also Emma Akumano.
So pacemaker is primarily something that we implant if someone has a heart rate or heart rhythm that is too slow. So if a patient comes in where the top chamber of the heart is going at 100 beats per minute, but the bottom chamber is going at 30 beats per minute, they may have symptoms of feeling tired, feeling lightheaded, feeling dizzy. They may pass out. So that's where a pacemaker comes into play, where we implant it to regulate really slow heart rates and heart rhythms.
Oh, it was just in the panel. What's the question? I say. Next question, about it's about parathyroid. I say, who the course parathyroid. I think say parathyroid is not a question. I say be no question. We say the course things I can say.
Yeah, so the parathyroid gland is a gland in your throat close to your thyroid gland that regulates calcium and calcium regulation in your body. Sometimes, parathyroid gland can be elevated, related to certain conditions, like if there's any sort of cancers or anything like that. So if you do notice any symptoms where you have a fullness in your throat, or it looks like your throat is getting a little larger, that is definitely something that you'd want to talk to your doctor about. It could be your thyroid gland itself that's enlarged, but that definitely should have an assessment in person with your cardiologist or your primary care doctor.
Okay, don't get the another question, the say over high cholesterol level. Na adrubia unumbia and my liver enzymes, a cosra. Is there any other option for the paprana?
Yeah, so so I think the two main issues with statins are muscle pain, and it can cause your liver enzymes to be elevated. So oftentimes, if you do have issues with your liver enzymes, typically what we would recommend is you may be put on a different medication to treat your cholesterol. So Usually we'll check your liver enzymes before you start these statin medications, and then we'll check it again. And if there are any issues, we may switch you to a different medication.
There are a few other things you can do to bring your cholesterol down. One is diet, and the cholesterol is a pure animal product. So if you cut down your use of animal foods, that will help bring your cholesterol down. In terms of medications, for those who cannot tolerate the statins, there are a few other agents on the market, one of which is an injectable medication that we can also use to treat the high cholesterol, except that these newer medications are more expensive. Sometimes the insurance company doesn't want to pay for it. So, but there are other options available. Mm-hmm.
Okay, that's it. The next question, if a blood pressure, you can say, obi or high blood pressure, a bit me manako mayekesi.
So the condition that we think about when we talk about a large heart is something called cardiomyopathy, which means that your heart is getting large and the heart function is abnormal. So the way that high blood pressure can do that is you can imagine that when your blood pressure is high, the heart has to work harder to overcome the blood pressure to get blood to leave the heart and go to the rest of the body. So that repetitive stress on the heart can lead to certain side effects and remodeling of the heart where the heart become weaker. So that's also one of the main reasons why typically when someone has high blood pressure, we want it to be treated so your heart isn't having to work quite as hard.
Okay, don't was it. I can't one question of yesterday, Mahasi, maybe, sir. Oh, Nipano Ebisa say, na the doctor say, onya neuropathy. Now, I'd not to a droso, a drono no man, a man, ne yam, a ya. Now, Ubisa say, wanum in Runo, na, sad neuropathy na wanyano, bit na kofa or how be abreno, a triana.
Yeah, so I suspect that medication might be gabapentin or Neurontin. So neuropathy, again, one of the ways to address it is to identify what the underlying cause. Is it related to diabetes? Is it related to untreated diabetes? Is it related to any other neurological issues? Neuropathy can be quite painful, so oftentimes those medications are used to try to suppress or alleviate pain. So if it is a medication that is causing side effects or issues, the important thing, or one thing that you can do is to talk to your doctor about alternatives or other medications that you could potentially to address that problem.
Doc, it was it. Will be the question about Kwaba. I don't know. So Uber Jama or Mother or Badia or say oatmeal. Yes, a bit more wow at 2 cholesterol. So
Yes. Overwhelmingly, yes. And I'll let my mom talk more about that tomorrow, but the answer is definitely yes.
Yeah. Doc, and it was it. Okay. Another question about things will be a last question. Any panel? Ubisa question is about DVT. So ubia onya DVT panel. Dear na onye srebeya enroka ebium. Na consequence be na a whole mano.
So DVT is oftentimes related to some sort of inciting event. So someone who's had surgery, other sort of things like birth control, those sort of hormones increases your risk. If you are going long trips, like if you're going to Ghana and you're sitting for long periods of time, not moving your legs, those sort of things increases your risk. So the important thing is if you are going to have any of those conditions, especially long trips, they're driving in a car or flying, you want to make sure that you exercise your legs. You can use compression stockings to keep the blood flowing to reduce that risk. One of the main issues with patients that have DVTs is when it goes through your lungs, causing a pulmonary embolism. So that's something that can cause patients to come into the hospital with difficulty breathing. And if you have recurrent DVTs, that can cause your heart muscle to become weak and things like that. So it is important to, if you have had a diagnosis of DVT, to identify why it is. Sometimes your doctor can see if you have any issues, any hereditary issues that predispose you to having a DVT. So those are all things that is important to talk to your doctor about. One, both to reduce your risk and also ensure that you don't have any long-term issues.
Your dog at the Wasipa, Yami in show. And wapan so better actually my program here kama on also Yami in show. And addition not for and aha and edibisi. Doctor say be kono member points in case oh big kakrebi eka and sana ya bompaye di ni na kwa bewe ya.
Oh no, so just to remember that there are certain sort of conditions that in cardiovascular disease that you have to think about. It's really important to make sure that you see your get routine care, and ultimately, I think always remembering that God is the premier physician. Any issues that you have, always bringing it to Him, and prayer, fasting, and meditation, reading the Word of God to mentally build your strength, which will definitely translate to physical health.
Your dog at the Wasipi. So this kind of me in show no on car. Now on my deal you be ano and yakesi and mount said the wire okasi on course one okasi. And my unu abusuan ni nyina nyame insira opi. Na da no yetu ensafre wa watimi abana watimi nso no abeboaye. Ene okama bebrebe aboyare wa hodo bebrebe so. A me giri se etiefu ni nyina no obia a benefit ewom. Nyame insira na onka oni abusuan ni nyina ho. Imse nyankopon bo a meme da wi anso no ma e ba wo ba betarachi na ensem bise bia obi antimi amusa no so so obusa watimi nso no abusa na mi insida opi ene sabre mesre ama esofo pastor sakode pastor mesre so betwa back to that so my yana
Yeah. Yeah, that's it. Yo, Dr. Adjei-Poku nyamishira pa enimdia nyamidia mao ene uluma ene family ni nyina. We appreciate it so much. Milano break the amount pa entama sana akati off. Eja eda wasi bebre na watwi ni awaye edi amaye yeni aso. Yemrantie yemaba waye papa nom yenu ampanyifo nyansa ne nimdia duma chede a odi ama womo. Yeah, wamude chire ya pomuden eja. We are so grateful. Thank you so much. It's not easy to become a doctor. Years of hard work and resilience. But some tio or how I'm on my film and son or my drum pempen. So a lot of practice, a lot of research. It's also so abom ho ban mo mapomuden. Omo hwe apomuden so no na so hwe omo so die. COVID ba ye awrewosem a doctor for bebre ayare bebre infected bebre struggle. Bi kura free mu ya. And I was say ye nuanum ye busua da so tiase. Koso abom ho ban. The Omajumani are very risky, handling diseases all the time. I mean, say well, they overcome ma strong immune system, they overcome infection in Yaribia. Omanya kwatente ni ahoden dia hwe. Na yesua na wotwe ni nwumre nyina me mfa mo ebra. Titru, it is a representation bia na omo boss say any exercise. Sana wo ye nipadua no to exercise it, to move around. The enyumre boy na yenya dense life. Ye dey ane ada ye take am ni akwatena of ye to computer ho. That's all we do. Ye enima ni computer ni edidi exercise ani computer ni edidi no. Fa cheye. Afi yentimi ntretre apom na ma yatimi a prevent yare bebre. Yakuma is the center of our body. Na de moja koba de niam bebre koba. Emu bia yakuma yemre by way of eating or lifestyle and as ye dia wo ye no. Enyumre hu ye mobo na say ade. Say ye benya heart attack and stroke and hypertension na take away a be shorten your lifespan and as be take away the quality of our life the radiation. Ye mobo na yifre yen so. Enyumre ye Dr. Adjei-Poku Shawunsa abrantie for more years to work. Shira ono ne yire ne manyina ne ministry. Clinic oda no ye panyi wo ho no man nyansa ne nimdie man edika honhom man abutre ni maturity ma bofo miensan kransem no oye adwuma nyina no enam ne mu nhire ma wo ma wo nyina. Yada wase ye bekoda enim ye ho so hwe anadwi ma bofo mebo ye ho ban hwe ye nso so ya da ye pa enyi wo ho di nkyire ye nsa ye wo pa adepachi asori aba bedawase. Edi onua danso ye health ministry director on any team adwuma pa o mu ye aboa ye nyina ye do mu hyem sa ja koso hyira wo mu nyansa ne nimdie onya hyehye mpa ma ye nyina ye da wase enwumere so tie wo Yesu di mu amen.
Amen. Amen. Also for said was tembia kai dwumadi achi. Na ma na me uhwe ye program na nka ochina no nutrition but in say kakre abem eyi no ekọ nyakopon bo amemenda area. Nyambo a ochina enya doctor ba ko onu so asiesie no doctor oye scientist or sade adusua efa ema ho ebiem eba we ema by different side or side e babiem ti meshe ye maame mu ne enua ma mo ne eyirim nyina no besere mo nyambo ochina yensa me la yiso we be ma ebeboa wo ma na oyiri nyina nti wo so bra na ebetie sa program no ebi a doctor ba ko osisi no o scientist or the addition no or the airbrain nyagopon bo amemenda na aye nutrition no ti nyagopon kan ho wonhwe yen so omo ye ho ban no ma adepa enchie nyambo a the same time 7:30 ebehia mu bio ene mamo mispa
Yedentitemu yeho ahwe me no ntem amen.
Go on.
Shadi mania jisamanya wajiphobia odima samami. Shadi mania jisamanya wajiphobia okama samami. Odimeni odimichi okame ho obomichi damda. Odimeni odimichi okame ho obomichi damda. Yesunti michimu ya mito. Minina china ni mediti ya udebi. Shami basa obe jinjini miho. Osu amini suwe nina. Yesu nti mitimu ya mito. Minina china ni mediti ya udebi. Shami basa obe jinjini miho. Osu amini suwe nina. Enti odimeni odimechi okame ho. Obomichi damda. Odimeni odimechi okame ho. Obomichi damda. No fear the Calvary. People listen to me team of one. Okachira mi se me ba Maria won kwaji etumano. Asase so ni suruti mi nyina shamizanti. Mensi oshi ramedi wani akudi enyina mu. Odimeni odimechi okame ho. Now no fear the Calvary. People listen to me team of one. Okachira mi se I draw a real one. tia chumano. Asasa sone suru to me, Nina Sami Mensushi, Namati, when I put the menti, or tapo the money to your miss. Oh, Metia miss. Tapo the money to your miss. Oh, Metia miss. Pema etina, maybe I could take no, Metia miss. Pema etina, maybe I could take no, Metia miss. Many money, I'm a chinatino pa. Oya kunim difu Oti Okameo, Obamisidom, Wunumania, Yambi, Wanga, Terion Ponyanko Pona Machi, Wunumania, Buruma Jenso, Terion Ponyanko Pona Machi, Samuel Finia, Waje Chamunwa, and Yemasuro, Yadamani Molons, Refita, the cow, Mama, and Sametinda, Numanina, Yamin Wanga, Terion Ponyanko Pona Machi, Numanina, Buruma Jenso, Terion Ponyanko Pona Machi, Samuel Finia, Waje Chamunwa, and Yemasuro, Yadamani Molons, Refita, the cow, Mama, and Sametinda. Is Ramanina, Boom, Philistic for anymore. If you are referred, I will refer to me, my tia, Putu, at any 2 minute initially, a car kind of good tia, Sisu, and money from the Suwa Papa, a Papua David, Timothy, Nadine, Kunimati, and Nano, if we near what if you near what and no sanity, my wedding, couldn't wife. I said, Nana. Send me some Virginia, was surrender so. That's all, sister, be patching or giant Ubia. It's a me bono, me kuno, me jenny free nanum. It's a yamia or the Mexico Surasuno or the many more medinguni. Or say, Nana. Send me some Virginia, was surrender so. Nasa sister be patching or giant Ubia. It's a me bono, me kuno, me jenny free nanum. Bisenya me out the Mexico Surasuno or the many more Goliath Fia. Odi Mechi, or come home, or bomb sit down down, Odi Mechi, or come home, or bomb sit down down, Odi Mechi, or come home, or bomb sit down down.